My name is Prashant Warier. I'm the co-founder and CEO of Qure.ai. I am a data scientist by training. I've been doing data science for about 22 years now, and have built AI algorithms from all fields, from trucking to fashion to advertising, and started healthcare-focused AI-focused healthcare company about 6 years ago, Qure. The focus was on interpreting radiology images using AI. So we built out X-ray interpretation, CT interpretation, both head CT and chest CT, both chest X-rays and musculoskeletal X-rays, all of them using AI. And today we are a AI-enabled interpretation platform with also a lot of workflow solutions which enable this AI solutions to be consumed by radiologists and other physicians in a timely manner. We have multiple solutions. We've got an X-ray AI solution, chest X-ray AI, musculoskeletal X-ray AI. We've got head CT AI, chest CT AI, and others, right? What we are using here is specifically the chest X-ray AI, and this is focused on lung cancer. So lung cancer is the biggest cause of cancer deaths in the UK. And with lung cancer, there is a very substantial challenge because a lot of times lung cancer is diagnosed late. And that is because till the mass becomes very big in the lungs, patients don't have any symptoms. So patients have lung cancer, but they don't know. And by the time they get to know that they have lung cancer, it's already too late to treat it or to operate on it. So what we are doing is we are helping diagnose lung cancer early using chest X-rays. So if you look at X-rays, all of us take X-rays for so many reasons. I mean, we have take X-rays for COVID, or you take X-rays for multiple kinds of lung infections, any kind of cough or cold. Maybe it's an annual checkup that you do. If you immigrate into a country, you have to take an X-ray. There is so many different X-ray reasons to take an X-ray. And on those routine X-rays, you can potentially identify a nodule, and you can also identify whether it's potentially malignant or not. And that is what we're doing, that we are looking at X-rays taken across the NHS, and we are identifying where there is a risk of lung cancer. In the patients where we identify a risk of lung cancer, those patients are then investigated further using a CT, and if required, a biopsy, and then confirmed with lung cancer as needed, right? But idea is to find people with lung cancer early so that they can be treated, they can be diagnosed first, and then they can be treated. And that's the problem that we're solving. So we are looking at these next 12 months in 5 phases. The first phase is deployment of QXR across 8 NHS hospital trusts. These 8 partner sites, including Nottingham University Hospital, NHS University College London, NHS Royal Marsden, will deploy there. And there will be 2 pathways. One is people who receive routine care and people who receive QXR-based decision support. So as soon as the X-ray is taken, QXR AI will identify whether there is a lung cancer risk or not. And based upon that, you'll do a CT and you'll advise the patient to do a CT on the same day. So we'll look at first is the deployment, and then deployment across these pathways. Second is looking at outcomes. So what is the turnaround time for a CXR report, for a chest X-ray report, which is basically a chest X-ray report without AI, and what is the chest X-ray turnaround time for a chest X-ray report with AI? What is the time to take a chest CT? What is the time to get a lung cancer diagnosis? We'll compare all of that between the routine care pathway and the pathway where the AI is part of the pathway, right? And we expect that the QXR, with the QXR report availability, will reduce the time to CT scan and also reduce the number of urgent referrals to respiratory medicine with a non-cancer diagnosis. So we expect to reduce these. Third phase is health economics. We're looking at cost effectiveness of AI triage. So we'll look at what is the cost on the regular routine pathway and what is the cost of the pathway where AI is interpreting the X-ray as well. And we look at what is the return on investment analysis. We look at identifying the net benefits related to net costs and so on. So that's the health economic piece. Last piece, the fourth piece is patient engagement. So we look at questionnaires and interviews with patients, basically identifying what is the patient seeing from their perspective. Are they seeing reduced wait times? Are they seeing faster diagnosis? Are they seeing better quality of service that they are getting, right? And we'll sort of look at that patient perspective, which is the number 4. And number 5 will be disseminating results. So once all of this data is there, the health economics data, outcome data, even the patient interviews and so on, we'll publish these in peer-reviewed journals. We'll present in some of the top conferences in UK and abroad, and disseminate to physicians across the world. Maybe also through some marketing content like this, right? So one is more sort of peer-reviewed content, and some might be more marketing content. I think the experience has been amazing. I mean, I remember like talking to Katrina, who's our PM, way back when the competition was still sort of, the competition was still being evaluated, right? And they always came back with the right questions, right guidance on how we should submit more information, what is information that is missing. So I think the support that we receive, right? And I think that's, if I look at one highlight, I mean, the support that we've received throughout the process in terms of guiding us has been tremendous. And we have been part of other competitions like this, other grants, awards like this. And what we have seen, I mean, both in UK and globally, right? And what we have seen is that the kind of support that we receive here is so much more, because a lot of times it might just be that, okay, somebody will award us a project and say, you figure it out. And then it's on us to figure it out, right? But here, I mean, I think with Katrina and the team, they have always been super involved and telling us how we can improve things, how we can, guiding us on how to make stuff happen, right? Make sort of on moving in the right direction all the time. That guidance has been very, very good here at this PRI.